TMJ4 News has learned that not all patients getting elective surgeries through Aurora Medical Group are getting tested for COVID-19 beforehand. Lauren Linder spoke with a nurse who feels her hospital is putting lives at risk and has a story you'll only see on TMJ4 News.
We've received a number of messages from employees at Aurora concerned about new COVID-19 testing guidelines. I spoke with one of them, a nurse. We distorted her voice to protect her identity.
How do you make that decision which patients you're going to protect and which ones you're not going to protect?
This nurse is concerned for her safety and the safety of her patients and colleagues. She works for Aurora Medical Group at one of its hospitals in southeastern Wisconsin and says they're so low on COVID-19 testing swabs, they're no longer testing everyone coming in for elective procedures.
Previously, we had canceled people that were positive, and if we didn't have the ability to test them, we didn't proceed with elective surgeries.
She provided us with emails that reveal Aurora hasn't received the last two shipments, totaling 17,000 tests. It says typically they've been testing nearly 14,000 people a week.
I just want to make sure that people are safe and that they know what's going on.
Chief Officer of Aurora, Dr. Jeff Barr, says all healthcare organizations are facing shortages in testing supplies, with the federal government ordering suppliers to redirect their swabs to other hotspots. He confirms starting Wednesday, not all people getting elective procedures are getting tested.
We've had to re-explore how we go about testing and how we prioritize testing.
Specifically, he says they will be testing patients getting aerosol-generating procedures like those needing intubation, but says the situation is fluid.
The CDC has pointed out that certain procedures that are not aerosol-generating do not increase risk for exposure.
Dr. Barr anticipates they'll get more supplies later this month, but in the meantime, this nurse feels patient safety isn't being prioritized.
Every patient values their lives and values their safety on the same level and deserves the same level of consideration and service.
Another problem is PPE. The nurse tells me they're short of supply. They need to feel safe, but Dr. Barr tells me that they're comfortable with their supply. Reporting in Milwaukee, Lauren Linder, TMJ4 News.